With male procedures, I typically see men who are interested in rejuvenating their eyelids, faces, chest as far as gynecomastia, even liposuction of the abdomen, arms, legs, and even abdominoplasty. So every year that popularity has increased. When we talk about eyelid surgery, most likely upper eyelid surgery, it's a single incision in the upper eyelid, which takes about 30 minutes under IV sedation. Most patients are back to work within about a week to 2 weeks, depending upon the type of job that you have. If you have a physical job, it might be longer than that, but in more sedentary, computer-driven jobs, you're back to work in 1 to 2 weeks. As far as facial rejuvenation, the same process. It's about 2 to 3 weeks off of work and about 3 weeks off of exercise. More commonly, men see me for gynecomastia, which is male breast tissue. It's a very common problem, and some experts range it anywhere from 30 to 40% of men as they go through puberty will continue to have breast tissue. There are a couple of ways of doing that depending upon the severity of the breast tissue. Sometimes we can just do a direct excision, which is an incision just underneath the pink part of the nipple, and just remove the tissue directly. I usually do those under either IV sedation or general anesthesia. It's just all the incisions are based right at that level. There's no incisions on the chest wall itself except for right under the areola. All the stitches are dissolving. It's usually about 3 weeks off of exercise, and most men are back to work within the week. Now, if it's a little bit more extensive and you have a wider range of breast tissue and some fatty tissue with it, then I usually combine a direct excision with some liposuction. And usually I'll make one small incision underneath the chest in the fold and liposuction the entire chest on both sides, removing the excess fatty tissue for better contouring, and then make that same incision on the lower part of the areola to remove the breast tissue directly. Again, it's probably about 1 to 2 weeks out from work and back to exercise in 3 weeks. Now, liposuction in general, when you're talking about abdomen, arms, legs, that's usually the lowest downtime, usually about a week off of work and exercise. Most guys are back to exercising in 1 to 2 weeks. Those are usually done through small incisions. When I do liposuction, I combine 2 different modalities. One is Vaser, and that's an ultrasonic cannula. So once I make that tiny incision, I'll use the Vaser cannula first to dissolve or break up the fatty tissue in the areas I'm going to liposuction. Once that's completed, then I usually put in a hollow cannula that vibrates, or what's called a power-assisted liposuction technique. And then I aspirate the fat through a cannula. The whole thing about liposuction is not a weight loss procedure, it's body contouring. Most patients will wear some type of compression garment for about 4 or 5 weeks, but again, the downtime is limited because the incisions are small, and most guys are back to work in 1 week and back to exercise within 2 weeks.